This is Diane. She's an elderly woman whose life took an unexpected turn when she experienced a fall, resulting in a hospital visit for her injuries. After receiving the necessary medical care, Diane was ready to be discharged. However, her journey to recovery hit a snag, not because of her health, but due to the absence of social support and assistance at home. This makes her an alternate level of care, or ALC, patient, caught in the gap between hospital bed and home care. Like Diane, over 100,000 Canadians find themselves as ALC patients annually, occupying beds that cost the healthcare system over $9 million daily. This issue is intensified by Canada's aging population, straining our healthcare system and highlighting a critical gap in patient care. Now, imagine a world where community members empower Diane and others like her to transition smoothly from hospital to home. Our solution is beyond freeing up hospital beds. It's about reimagining care to build independence and compassion at every stage of recovery.
To address this, we created an innovative solution by implementing time banking, tailored to the elderly and facilitated through a digital platform that connects volunteers and those requiring assistance. Time banking is a system where individuals volunteer their time to help others with day-to-day tasks, and in return, they earn credits for the hours they've contributed. These credits can be redeemed for assistance when they need a helping hand later on, creating a reciprocal community of support. Through our application, we will have a system for volunteers to sign up, keep track of their hours, and connect with seniors in need of support based on their schedules.
Our first phase taps into the vibrancy of youth, offering Western University students a way to contribute meaningfully while building a bank of hours for themselves. Volunteers can assist with a variety of tasks, from grocery shopping, ensuring medication compliance, to providing companionship and assisting with technology uses. As the program gains momentum, it will expand to a wider community, embracing recent retirees and high school seniors in Phase 2, broadening the spectrum of assistance provided and the diversity of those we serve. This expansion is not just about growing numbers, but also deepening the impact, ensuring that more elderly individuals like Diane can transition smoothly from hospital to home, surrounded by a supportive community network. Our vision doesn't stop there. Phase 3 looks to the horizon, dreaming of integration with government services and exploring innovative ways to utilize the banked hours, making our solution a cornerstone of elderly care. Through this phased approach, we're not just addressing immediate needs, but building a sustainable model of mutual aid and community care that promises a healthier, more connected future for our aging population.
Now let's take a step back to the foundation. A common concern is safety. How can we guarantee the safety of the volunteers and the patients? We can do this through comprehensive background checks and mandatory training for volunteers to ensure a secure environment for both helpers and those who they assist. Another concern is, how do the first ALC patients receive their hours? To this, we propose a pay-it-forward model, where new users such as current ALC patients will receive immediate assistance since they cannot build hours to redeem right now. Another obstacle that may arise is the initial willingness to volunteer. Why would anyone sign up? Aside from the returned hours and community building, the opportunity offers many incentives. In terms of volunteer recruitment, we boost motivation through unique incentives, such as recognizing volunteer hours as valuable for internships, jobs, and educational programs, as well as enhancing the appeal with rewards from business partnerships.
The successful implementation of our time banking system marks a transformative step for Canadian communities. It encourages mutual support, enriches volunteer experiences, accelerates patient discharges, and alleviates the workload on medical staff. This initiative has the potential to free up approximately 8,000 hospital beds daily, leading to savings of over $3 million per day. To contextualize, these savings could underwrite the hiring of 37 new nurses, or the acquisition of 1,000 long-term care beds per day, directly benefiting our healthcare infrastructure. Canadians would not only experience shorter wait times from freed up beds, but volunteers and recipients will contribute to and benefit from a system that strengthens community bonds and personally enhances their well-being. The end result is a significantly improved healthcare experience for every Canadian, characterized by efficiency, compassion, and a sense of community unity.
Today, the Canadian healthcare system is under significant strain, facing challenges that require immediate intervention. A critical issue is the rapidly aging population, putting unprecedented pressure on healthcare resources and intensifying the ALC patient crisis. This demographic trend is not merely a future concern, but a current reality that threatens the sustainability of our healthcare services. The time for action is now, capitalizing on advanced technology and the collective strength of our communities to prevent a looming crisis and protect the health of every Canadian.